Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, listener. I am excited to be back with part 2 of To Do or Not to Do, to have or not to have a hysterectomy, which is removal of the uterus. And this is a very pertinent question to ask, as most women at some point in their lives might be confronted with this decision. First of all, just as a reminder, hysterectomy is removal of the uterus and is most commonly performed for either abnormal uterine bleeding, long, heavy, painful periods, usually caused by adenomyosis, fibroids, chronic pelvic pain, likely from endometriosis, for premalignant and malignant conditions, and for pelvic organ prolapse. So the reason why we need to have this important discussion about removing the uterus and the hysterectomy, the pros and cons of it, and other issues related to hysterectomy itself, is because the statistics are very impressive. You might not know, but there's a staggering lifetime risk for a woman to have a hysterectomy estimated to be 45%. 45%. Apparently, hysterectomy is one of the most commonly performed procedures in the United States, with nearly 500,000 hysterectomies performed every year. And you should know that it's estimated that more than 40% of women will definitely end up having a hysterectomy during their lifetime. So we do need to talk about this. This is something that concerns you. Even if you're in your 20s and 30s, you're like, I don't need to remove my uterus. My uterus is perfectly healthy. I'm a young, healthy woman. The principle of 1 ounce of prevention is worth a pound of cure. It's something you need to pay attention to, because the what if at the end of the line might impact how you take care of your uterus now, how you address your hormones now. So as promised, in this episode, I will discuss the cons of having a hysterectomy, the major negatives. I also want to cover the risks of a hysterectomy and the alternative solutions so we can avoid removing the uterus. What are some of the technical issues that need to be considered when deciding to have a hysterectomy? And last but not least, why a hysterectomy might be easier on your body than you think, and how menopause is not a cure for whatever ails your uterus. So let's get started with what is the downside or the negative aspect of having a hysterectomy. If you haven't listened to the previous podcast episode, I actually closed that episode by mentioning 6 major advantages of having a hysterectomy. The cure of whatever illness or ailment of the uterus you have, cancer, fibroids, or something else like horrible periods. Number 2, no more periods ever. No more babies, so no more need for birth control. No more need for pap smears. No more risk of uterine cancer. And no more worrying about balancing estrogen after menopause with progesterone, which now becomes optional. So some of these advantages could be clearly disadvantages or very negatives for someone else. So again, what could be advantage for someone could be a terrible disadvantage for someone else. So I'd like to discuss both sides. And for any woman that has doubts about having her uterus removed and sort of looking at the dark side of this, she should openly discuss her doubts with the physician that's taking care of her. I also recommend you might want to read a book called The H Word. It was written by a woman who felt she suffered an unnecessary hysterectomy, which caused her lifelong suffering and distress. Now, mind you, this book was written many, many years ago. The hysterectomy techniques have changed drastically since. So some of the items that are in the book might not be pertinent, but it's a very good book if you're confronted with the H word and you don't know which path to take. So first of all, what are the things that could happen that would be a major downside to having a hysterectomy? Well, number one, for starters, your capacity to bear children is over. So having a hysterectomy equals no longer being fertile. If your ovaries are left behind and they function well, and you have a good ovarian reserve, in that circumstance, thanks to the modern technological advances of what we call reproductive endocrinology, a fertility specialist can still help you have children by harvesting your eggs, combining them with your partner's sperm, and if they fertilize well and there's a healthy egg, it can be implanted in a surrogate, which is a woman that will carry your child to term and literally carry the pregnancy for you. So that's your baby, your genes, your husband's genes. So not all hope is lost, even if you lost your uterus and you're in your 20s or 30s, or even early 40s. Amazingly, modern science comes to the rescue to help you get pregnant, even when you lost your uterus. Now, it will cost a boatload of money. Reproductive technologies are not cheap, and insurance companies will pay for any birth control method currently in existence, but they will cover zero expenses to have a fertility consult, fertility tests, or treatments. There's also some uterine transplant research being definitely done and underway. So as I know more about this and there's more information available, stay tuned. I might bring a podcast guest to talk about this in the future. So as you can see, for some women, not having to worry about birth control is a huge benefit and a big pro to having a hysterectomy, which is the ultimate form of sterilization. But for some women who are still considering childbearing, having a hysterectomy recommended to them is a major downside. It's a major negative. And it carries a very clear finality with it. So obviously, alternative solutions should always be considered in women that desire more children. Number two disadvantage of the hysterectomy procedure is you will not have a period ever again if your uterus is removed. Now, this might be awesome for women who are having this procedure as a cure for their terrible periods. However, keep in mind that all major uterine pathology outside of cancer might have multiple alternative therapies that should be tried before removing your uterus is recommended. Hysterectomy should be the end of the road, the long road of trying to balance your hormones to address medically whatever ails your uterus. And again, losing your period, never having a period again, might not be the best thing, even in spite of many women believing that this is a major relief and it's an awesome thing for their bodies. This is not the best thing. And let me talk about this for a minute. Why it's actually good for a woman to have a period. Well, top reason is because having a period thins out your blood naturally. Keep in mind, as soon as you hit menopause, or you have an endometrial ablation to stop the periods, or you take a birth control pill regularly, daily, skipping your placebos to avoid having a period, or as long as you have a Mirena IUD that chemically ablates the uterine lining and you don't have a period, you lose your ability to menstruate, to shed the lining once a month. And in the absence of monthly shedding, your blood becomes more viscous, clottier, and thicker. This increases your risk for cardiovascular disease. So again, having a period naturally once a month helps our heart, helps our cardiovascular system. And once you don't have a period anymore, your risk for a cardiovascular problem, a stroke or a heart attack will go up. Another reason why having a period is awesome, having a period allows you and your doctor to understand your hormones, whether they're working as they should. Your period is a sign of how your hormones are working together and whether you have a good estrogen-progesterone balance. Without a uterus or without a period, both you and your doctor will be in the dark unless your hormones are tested or unless you and your doctor or both of you and your doctor are knowledgeable enough about other symptoms that suggest sex hormone imbalance. And you can tell there's a problem. Mood changes, fatigue, acne, etc. So we lose a very important informational tool that there's an existing dysfunction hormonally when we lose our periods. Also, having a period allows our bodies to cleanse, not just cleanse our uterus, but also cleanse our blood. In one of my recent episodes, I talked about PFAs. Those are polyfluorinated chemicals that linger in a woman's body for decades. They are called forever chemicals. They can only be eliminated by blood. Donating blood, you just give it to another person. During pregnancy, you just give it to your baby. Bleeding at the birth of your baby, or bleeding out these toxins during the period. And for some women who suffer from genetic conditions like hemochromatosis, where you have too much iron, or from a blood condition called polycythemia, when a woman makes too many red blood cells, not having a natural, normal monthly period, it's a big problem. Because in these cases, there's an increased risk for your health, and managing these conditions, it's now much more difficult without your ability to bleed naturally, which is offered by the presence of hormones and by the presence of your uterus. And last but not least, many women consider having a period as a benefit. For some women, this is part of the cleansing process, not just physically, but also spiritually. And this takes me to your next downside of having a hysterectomy, which is the fact that some women link the presence of the uterus in their body with their womanly spirit and essence. So obviously they could experience a significant feeling of loss and maybe failure. And for some women, having their uterus removed means a great deal to them spiritually and emotionally. If you identify yourself as one of these women, then definitely discuss with your doctor to try everything possible to save your uterus. And wait until the last moment, till you have bled for years and had pain for years, and you've gone to doctors who have not provided you with a solution and thought that there is no solution. Please fight for your uterus if this is how you feel about your organ, about it being the essence of your femininity. Fight for your uterus, get second opinions. There's multiple options, so you don't end up at the end of the road when that's it. Hysterectomy is your only option. Again, I also recommend reading the book called The H Word, H for hysterectomy, because many women have a lot of questions. This takes us to our number 4 downside, sex, sexual function after hysterectomy. Is sex going to be painful after the procedure? It's a question I hear a lot. Will I still have an orgasm? Will it be harder to have an orgasm? And these are very valid questions to ask, and the answers will be very different depending on your age and the actual condition causing the uterine disease. It will be very different whether your ovaries will be removed or not, and whether your cervix will need to be removed or not. So sexual function is important after such a major procedure. This needs to be discussed with your doctor and obviously taken into consideration when a certain surgical technique or a certain approach is going to be used. So there is a significant downside for some women after a hysterectomy, which is the loss of their capacity to have a uterine orgasm. And if you're not sure what a uterine orgasm is, well, during an orgasm, a woman might experience actual uterine contractions as a very pleasant, enjoyable, pleasurable sensation. Those contractions would no longer happen if your uterus is removed. Now, not many women have a uterine orgasm. And if you have no idea what I'm talking about, then you're likely not one of these women, so you don't need to worry about uterine orgasm and the loss of it. So another consequence that a lot of people don't talk about, and it's not one of the major downsides that we reveal or take into consideration, but I've had a couple of patients lately that have been confronted with this situation. And some of them, I have been the surgeon, and some of them had surgery with other physicians. So it's not really a technical issue or a surgical technique issue or a suture issue. But some women could be allergic or reactive to the sutures used during surgery, which can lead to an increased risk of a complication. The healing after the hysterectomy depends on how a woman reacts to the sutures that are used. Once the uterus and the cervix are removed, the vaginal canal, the top of your vagina, is sewed together with a specific type of suture. And if there is a bad reaction to this suture, it can create problems. Painful sex, pelvic pain, sometimes for months or years after the procedure. Now, keep in mind the chance of this happening is extremely small. This is not meant to scare you, it's meant to inform you. This happens almost never. And when it does happen, is because the woman has a very rare unknown sensitivity to this type of suture that is used. These sutures usually have a very long half-life. They last in your body a very long time, sometimes up to 6 months. If you do not tolerate them well and your body creates a strong inflammation to these sutures, this can create a problem. Unfortunately, we can't possibly know this beforehand. However, if you are a sensitive person that reacts to absolutely everything, and you worry about this being a possible complication for you, please know that this can be safely and easily addressed with PRP. Let me explain what PRP is if you have never heard of it. It's called platelet-rich plasma. We draw your blood, we spin it in a centrifuge, the red blood cells deposit at the bottom of the vial, and at the top of the vial, you have this liquid gold-looking fluid, which is platelet-rich plasma. It's full of growth factors, and it's extracted out of the vial into a syringe and injected into various tissues to regenerate them. This is a very simple treatment. And if this rare issue of a complication post-hysterectomy happens and you need to have it regenerated because you had a reaction to your sutures, you had an infection, something happened, we can simply resolve all that by injecting PRP in the vaginal cuff, which is the end of your vagina. This will work great to help heal scar tissue and reduce or eliminate any pain completely. Again, we are fortunate in our field to be able to use PRP injections vaginally or in the vulva or in the clitoris, as it can help heal many things that nothing else will heal. Most OBGYNs are not aware and have not been trained, but again, you can inject this PRP to help heal your body naturally without anything else being done. It just needs to be injected in the area that's inflamed or painful, and voila, many women have a complete and total relief of their issues. Now, ideally, this would be done within the first 6 months, 12 months from the hysterectomy, but again, any time is better than never. And there's no harm in trying, and nothing wrong can be caused by injecting PRP into a tissue that is sick, other than just helping it heal. There's no downside to it. So the last but not least, there are some risks associated with a hysterectomy. And before I get into this risk discussion, let me mention that the risk of a major complication with a hysterectomy, which again is one of the most commonly performed procedures in the United States, is under 2 to 3%. So what are the major problems and complications that can happen during removal of the uterus? Well, number one, pain. Pain after surgery, pain while healing, pain in the first 6 to 12 months, sometimes even longer if you end up with some kind of a complication like an infection or a dehiscence of the incision, which is opening up the vaginal incision, or a reaction to the sutures. Number two, bleeding. Bleeding during surgery can happen due to technical challenges, increased vascularization, because of the presence of either the cancer that the hysterectomy needs to be done for, or there's a lot of inflammation that the hysterectomy needs to be done for, the endometriosis, the fibroids. All of these pathologies can cause a lot of blood vessels that normally would not be there, which increases the risk of bleeding and possible risk for a blood transfusion during or after surgery. Now, there's also a risk for trauma and injury of a tissue or an organ that's not meant to be injured. And this is a risk that occurs with any surgery, with a cesarean section, with a gallbladder removal, with an appendix removal. Every time we remove anything out of your body, we risk traumatizing organs or tissue that's right next to it. So the most common serious injury that can happen during a hysterectomy is an injury to the ureter. The ureter is a tube that runs from your kidneys to your bladder. This tube allows the urine produced by your kidneys to travel into your bladder, where it is deposited and stored until you're ready and the conditions are auspicious and socially acceptable for you to urinate, to void, to use the bathroom. Injuring this tube, the ureter, can happen by incorporating it into a suture, burning it accidentally with the cautery, or accidentally cutting it or damaging it during the process of isolating the uterine artery, because those uterine arteries will have to be cut, ligated, coagulated before the uterus is removed. And they could be very close to the ureters. Now, if the damage happens to your ureter and the surgeon identifies it promptly, then he or she can call a urologist to fix it. Some doctors are trained and they know how to fix the ureter. But the best fixing is find the ureter, see where it is, where it goes, and then clamp, cut, dissect, do whatever you need to do once you know where the ureter is. If this injury goes unrecognized and is left untreated, the flow of urine will not be able to come normally from the kidney to the bladder. So it will back up into the kidney. Over time, the kidney will not be able to drain the urine any longer. It will be damaged and destroyed beyond the point of salvation. And that's usually something that happens very quietly, as in silently, because usually the other kidney takes over. And you don't know that there's something wrong if the ureter is severed, damaged on one side. Now, if it's severed and damaged on both sides, that's a big problem. There will be no more urine produced. That's very easy to diagnose. So again, this is a very serious injury. It's very rare that it happens because all OBGYNs who do surgery are trained to identify, respect the ureter, and protect it. Another type of trauma that happens quite frequently, and a lot of the times is not being discussed and it's overlooked as a possible consequence of hysterectomy, is some form of mild bladder dysfunction. So let me explain. The bladder, where you store the urine before you go use the bathroom, is found in your pelvis sitting right in front of the uterus. And in many cases, there's very intimate connection between the bladder and the lower part of the uterus, the cervix, and the vagina. They're pretty much very close together. There's very thin layers separating these organs. Now, in many cases, especially if a woman has a history of cesarean sections, a history of laparoscopic surgery for endometriosis, or any other surgery in the pelvic area, these attachments between the bladder and the uterus, which normally are very thin, very flimsy, they can be easily separated from each other, that separation is no longer easy to do. Now, these two organs, the bladder and the uterus, or the bladder and the cervix, could be somewhat sealed together, making the identification of a plan of separation very difficult. So in the process of pushing down the bladder away from the lower part of the uterus, so we expose the uterus and the cervix and we don't injure the bladder, in this process, some of the nerve endings to the bladder might be damaged. Now, those nerve endings are very important to allow for normal bladder distension and to allow your bladder to fill with urine without generating contractions all the time, causing you to have the sensation of urgency. And this brings me to one of the significant downsides or risks of a hysterectomy. A significant percentage of women after a hysterectomy might experience urgency and frequency, might need to get up in the middle of the night to void a few times, which is something they never did before. Now, the great majority of these situations are very transient. They resolve within 3 to 6 months, sometimes a little longer. Sometimes if they persist, we need to retrain your bladder. We need pelvic floor exercises. We need pelvic floor therapy. There's pelvic floor muscle strengthening technology like electrical muscle stimulation or HIFM technology like Emsella. So a lot of these technologies could improve your quality of life if this happened to you or if you worry that this will happen to you. Now, last but not least, another type of trauma that can happen is trauma to the intestines. This is a possibility because your intestines, the small intestine, the large intestine, they drape and cover our pelvic organs and the uterus, and they frequently get in the way. They frequently are found adhesed or stuck to the ovaries, the tubes, and the uterus, and have to be separated from the diseased organ before the diseased organ is being removed. Again, calling a general surgeon to repair the damage or dissecting extremely carefully to protect the intestine when these scars are present, these adhesions, it's very, very important and crucial. So obviously, the surgical skill of the physician chosen to do the procedure is critical. And just so you know, usually there are 2 surgeons performing the procedure, as the assistant has some training as well, if not at least equal to the primary surgeon. And again, skills and experience are very important in minimizing risk of complication. And choosing the right surgical approach for the right case is necessary, because trying to remove a very large uterus laparoscopically could lead to an increased risk of bleeding and trauma to other organs if the morcellation technique is not fully mastered. Or the same token, attempting a vaginal hysterectomy or a laparoscopic assisted vaginal hysterectomy for a very large uterus, when you don't understand the technical challenges, bivalving the uterus, inspecting the vagina carefully to make sure that the uterus did not tear the vaginal walls in the process of being removed vaginally. If you are not aware of all of these, problems can happen, and bleeding and other issues. Now, I talked a lot about the downsides and the negatives and the risks, but what you should know is that having a hysterectomy nowadays is no different as far as risk and recovery than having your gallbladder or appendix removed. If anything, it's a lot easier sometimes. Most hysterectomies are now done almost exclusively laparoscopically. It is safer, quicker, and easier for the patient. Laparoscopic hysterectomy means that a small incision will be done at the belly button to allow the camera to go through, and 2 small incisions in the lower abdomen below the belly button on each side of the midline to allow for the operating instruments. Again, there's 1 surgeon on each side, usually sharing equally, each surgeon operating on one side while the other performs the procedure on the opposite side. The laparoscopic access means minor, small abdominal cuts. We're talking about 2 centimeters or less, which means less pain and ability to go home same day. Yes, you heard me right. The majority of hysterectomies are now same-day surgery. You will go home in a few hours without the need for an expensive and extensive hospital stay. It also means less need for narcotic opioids to control pain. Many women simply use ibuprofen for pain after surgery. Again, 15 to 20 years ago, the majority of these procedures of hysterectomies were abdominally, done through an incision like a cesarean section. There was a large cut through the lower abdominal wall. It always involved a 3-day hospital stay, much longer recovery time, much more significant postoperative pain, and need for medication that was much higher, creating a delay in recovery. So, to kind of recap and approach the end of the episode, I reviewed in the other episode types of hysterectomy, why a hysterectomy might be necessary, the downsides, the benefits of a hysterectomy, but no discussion is complete if I don't remind you about the alternatives of a hysterectomy. So the top alternative your doctor is going to give you, if you're over 45, is going to be, let's try and wait for menopause. And I want to say a few words about that. Without giving a big lecture and going into very detail about each and every condition that requires a hysterectomy, what you need to understand is that there are different alternatives to hysterectomy depending on what the reason for the hysterectomy is. And understand that in the absence of cancer, the uterus is not always your offending sick organ. Sometimes it's just a simple vessel or a manifestation of a serious hormonal imbalance that's going on in your body. If your ovaries were to be removed or you entered menopause naturally, in the absence of estrogen, your uterus will no longer bleed naturally. So in many cases, the alternative medical option to avoiding a hysterectomy is 1, waiting for menopause, or 2, considering chemical synthetic hormonal therapies that will shut down your ovaries and induce a chemical menopause. So for example, if the reason for the hysterectomy is severe uncontrolled periods, we do have some very good alternatives to avoiding a hysterectomy, especially if on an ultrasound, your uterus looks normal and we don't have an explanation why your periods are crazy. In this case, the problem is usually the hormones. They will need to be fixed. Unfortunately, many conventionally trained OBGYNs do not focus or consider on possibly bringing your hormones back into balance naturally. That would involve looking into detail at the ovarian function, analyzing it, spending a long time with you, multiple visits, trying to identify possible problems and causes for this hormonal imbalance. Like, do you have a serious gut health problems that does not allow you to eliminate your hormones well? Do you suffer from SIBO? Do you have enough progesterone and you just need progesterone supplementation? Do you have too much estrogen? Do you have polycystic ovaries? There's a lot of questions and a lot of investigation that needs to happen to understand why your periods are crazy. So a very easy fix in this situation, and it's going to be the treatment that it's probably going to be proposed as soon as you tell the doctor your problem in the first visit. This is going to be use a birth control pill. By taking a birth control pill, a woman's ovaries are shut down. The small amount of synthetic estrogen from the birth control pill will tell your brain that there is enough estrogen in the body, even though it's a minuscule amount. So naturally, the brain signals will stop. There will be no more signaling or talking from the brain to the ovaries to make hormones. Without brain input, your ovaries are like a sailboat dead in the water because there's no wind. Or it's like a boat with no oars, no sail, no wind. If you don't like the boat analogy, it's like a horse-driven cart without a driver to tell the horses what to do. These horses will do nothing. They will just look for grass, happily eat it without pulling the cart to its destination. That is what happens to your ovaries on birth control pills. The small amount of estrogen from the birth control pill will create a very small growth of the uterine lining. So with time, the periods become less intense, the pain improves, and the woman thinks, great, I avoided a hysterectomy, which is true, but it really does nothing to solve the problem that led to the initial situation. As soon as you stop the birth control pill, your problem will come back. We need to do something while you use the birth control pill, looking into the root cause of the problem and fixing it ideally. So when a woman returns back to its normal healthy state, she will no longer need a synthetic birth control pill to treat her hormonal imbalance. Another way to thin out the lining of the uterus with conventional medicine means, but not taking a birth control pill, is actually using a synthetic progestin IUD like Mirena. This IUD contains something called levonorgestrel. This is a synthetic hormone that's very remotely similar to progesterone. It's a progesterone receptor disruptor, but it's very good at preventing the uterine lining from growing. And it's very effective in controlling long and heavy periods, even bleeding from fibroids. Now, I'll dedicate a podcast in the future and discuss birth control methods and pros and cons for each one of them, so stay tuned for that. Now, another extremely viable and useful method, which is an appealing alternative to a hysterectomy to a large majority of women who do not want to use hormone therapy like birth control pills or an IUD, is a surgical procedure called uterine ablation. Technically, it's not a surgical procedure because there's no surgery being done. There's no actual cutting. There's actually just introducing a camera into the uterus and burning the lining. You should know there are two technologies on the market, a radiofrequency device called NovaSure, and the other one uses hot water called hydrothermal ablation. This is always done during a hysteroscopy. Again, very different than a hysterectomy. Hysteroscopy, it's a procedure where the doctor opens your cervix, that barrel-shaped structure at the entrance of your uterus, to insert a camera into the uterus, fill the uterus with a sterile solution, which allows us, the doctors, to be able to see and evaluate your uterus from the inside. Then once we identify, treat, remove any pathology like polyp or hyperplasia, then the actual ablation is done by the radiofrequency device or with the hot water. Again, it does sound painful and it likely is painful, but we do this either under anesthesia at the hospital or in a surgical center or in office with some oral sedation. Again, these are 30, 45 minutes. The woman returns home in a few hours, very mild cramping, a little watery, bloody discharge that lasts a few weeks, and then they resume normal activity. Again, it's a little bit more complicated if the cause and the need for a hysterectomy is driven by fibroids. So you have much more significantly damaging surgical alternatives like a myomectomy, but it still leaves your uterus behind. What is a non-surgical approach, which is a procedural approach, it's uterine artery embolization. This procedure involves placing a very small tube called a catheter into one of the arteries in your leg. And then this tube is threaded under direct visualization into the vicinity of the pelvic area where the uterine artery is, using something called fluoroscopy. That's injecting a dye and watching it progress on the screen to know exactly how to advance the tube. Once the tube is in position, these small little balls are deployed to seal the blood vessel that feeds the uterus. This procedure is not done by an OBGYN. This is done by an interventional radiologist. Your OBGYN has to decide and discuss it with you, whether you're a good candidate for this procedure or not. And the interventional radiologist needs to communicate with your gynecologist about the criteria and whether this procedure is safe for you. Now, another way of avoiding a hysterectomy is by having a myomectomy. As the name indicates, myomectomy is the removal of myoma. It's just another name we use for fibroids. And again, the location of the fibroids, the proximity of the fibroids to the uterine cavity, the number of the fibroids, the size of the fibroids will dictate whether you are a good candidate for this procedure or not. The age of the woman also dictates whether she's a good candidate for this procedure or not. And this procedure does require some advanced skill. It can be done by opening the abdomen like a cesarean section, which means the woman will have an incision in the lower abdomen, but it can also be done laparoscopically. And again, some advanced laparoscopic skills are required to take out many fibroids, some of them very large, through a small opening, which is what laparoscopy does. But there is a significant risk for a major complication with this approach. The surgeon has to decide in the end, after all fibroids are removed, if the uterus can be reconstructed and put back together to be functional, which is why all women who undergo a fibroid removal procedure called myomectomy should be counseled for possible hysterectomy risk. So there's another procedure which I spoke more on in the podcast about fibroids. Please revisit that episode. It's called the Accessa procedure, that is treating the fibroids laparoscopically using focused ultrasound energy to destroy them. It doesn't destroy them completely, it shrinks them. So it's very different than a myomectomy, but there is no incision into the uterus. And it's much faster recovery time. So in the end, as I mentioned earlier, if you suffer from a benign, non-threatening uterine condition that will cause bleeding and pain, like fibroids or adenomyosis, your doctor might say, don't worry, it will all be gone at menopause. So let's wait. And that will happen if you're between the ages of 45 and 50. It will happen very, very often. And if that's happening and you have that conversation with your doctor, please challenge your doctor and ask, what happens if you want to use hormone replacement therapy after menopause? What happens if you have terrible quality of life? Ask yourself what happens if you, at menopause, will suffer from terrible hot flashes, horrible sleep, from unrelenting fatigue. What happens if you lose your sexual desire and interest in sex and it affects your relationship with your partner? What happens if sex is painful and can no longer happen? What happens if your mood goes from being happy to terrible? And you go from feeling super blah and depressed and not caring at all about anything to being super pissed and a crazy raving lunatic who yells at their husband, children, or colleagues. What happens if you start gaining weight and start suffering significant joint pain that doesn't allow you to exercise like you used to do? And what happens if suddenly you feel you could possibly develop dementia because you're foggy and forgetful? What if the cure for all these issues, for making you feel awesome at menopause, is actually estrogen? Then what? Well, then waiting for menopause as a cure for your problem will no longer be an option. Because when estrogen is started and we rejuvenate your body, and all of these bad things I just mentioned are rejuvenated and refreshed and resolved, and they're no longer there. When your energy is awesome, your mood is back to normal, when sex is great again, the estrogen will also rejuvenate the uterine condition. So your bad periods can come back. The fibroids will start bothering you again. The pain and the cramping can return. So at this point in your life, when you get offered the option of waiting for menopause, you need to be aware that you have to make a choice between salvaging and keeping a diseased organ, which means curtailing or avoiding estrogen in the future, versus the alternative, which is removing the diseased organ and allowing for adequate and effective estrogen replacement that will keep you safe from all the bad stuff that could happen at menopause that I mentioned earlier. So, as a conclusion, a hysterectomy can be a life and health-saving procedure, and it might be unavoidable in a large majority of women. What you should know is that the modern advances in the minimally invasive surgery field have made it possible for over 90% of hysterectomies to now be done laparoscopically. Same-day surgery, involving a stay of under 6 to 8 hours in the hospital or the surgical center, with minimal need for pain pills. Most women just take ibuprofen, with super fast recovery, allowing a woman to resume normal activity within a few weeks, and coming back to strenuous exercise and intimacy within 6 to 8 weeks. The risk of death for a hysterectomy is estimated to be 0.5 to 1.5 per 1,000 cases. So that's about 0.05 to 0.1%. And the risk of a major complication is no higher than removing a gallbladder or a non-ruptured appendix. Obviously, the risk is a lot higher. If you have a ruptured appendix, you could actually die from it, but you're not going to necessarily die from a hysterectomy that's done electively for very good reasons. I sincerely hope that this episode about hysterectomy opened your eyes about valuing your uterus and investing in the health of your uterus when you're young. Go to the doctor, have an annual ultrasound. I have a ton of young women diagnosed with adenomyosis. It's very hard if you suffer from this to keep your uterus once you approach menopause, especially if you don't do something to balance your hormones, to detox your body from endocrine hormone disruptors, which are likely, ultimately, the cause of all our problems. So if you wish to provide feedback, please feel free to leave me a review. I'm very interested in what you have to say and whether or not this episode has been helpful to you. Thank you so much for listening. If you are one of my faithful listeners and you are finding value and enjoying these episodes, please feel free to leave me a review on whatever platform you're listening to. Also, if you find the content in these topics useful, not just to you, but to someone else, a friend, a loved one, or simply an acquaintance that you know could benefit from the knowledge I share here, please feel free to forward my podcast to them. If you live in California and you'd like to work with our practice to help you achieve your wellness goals, please go to our website, www.herabeautyandwellness.com, and request an appointment. It will be our privilege to help you in any way, shape, and form we can. Any suggestions on a topic of beauty, wellness, or anti-aging are welcome. All you have to do is go to the website, leave a suggestion into the AI chat, and I promise you if you ask, I will listen and add your suggestion to my list of topics that I want to get to as soon as possible. Please join our Facebook group, The Wellness Optimizing Warrior MD. It's a small growing community that focuses on wellness, on what's new, what's safe, and what works in beauty, wellness, and anti-aging.